will. If you would, go ahead and place your name and campus in the chat. If you have done that, go ahead and make sure you're logged in with your devices so we can, this is a quiz that we're getting ready to take. You have to be in view. Make sure you have your two devices. Make sure you're in view. You might want to have your chargers in reach as well, just in case. Check your screen names. Make sure your screen name matches. So we have to be able to see you. Make sure you may need to turn lights on or turn them or dim them. I'm not sure which way you need to go, but make sure we can see you and your device. It needs to be positioned so we can see you and your device from the side. As always, these sessions are recorded and they are viewed by the attendance administrators. If you don't have a dry erase board, you can grab a blank sheet of paper and a pencil, and we will call for you to show it on the recording front and back here shortly. Just get it for right now. Just get everything positioned. Give you a few more minutes. So good evening. Hopefully everyone is doing well. I did hear a storm pop up, so hopefully we don't lose connectivity, but if we do, just stay right there. In the event that you have some connectivity issues or any other issues, always put a message in the chat to me. Let me know what's going on. If it's connectivity, just keep trying to log back in. Because it was on mute. Thank you so much. So good evening to everyone. We're going to go ahead and hopefully you've gotten settled now. Hopefully everyone is doing well. As always, these sessions are recorded. We're going to take this quiz 1, and then we will move on with our content. This is your first quiz and your last quiz in Canvas. So remember, we talked about it for the first week. Your next quizzes will be in SurePath. So you do have a total of 25 questions, and you do have the 30 minutes to complete it. So as always, in the event that you finish prior to the 30 minutes, we have to allow that at least that time frame. If you finish prior to that, then you can just turn your camera off, but just make sure you're back on at the time. I'll put a time in the chat. So let me know that you're finished, and I'll let you know the return time, because the time is going to officially start once everybody actually starts the quiz. Okay.
I have a question. I don't know where I go to SurePath.
We're not doing SurePath right now. We're not doing SurePath right now. We're doing
Because my quiz is still not showing up on
I
week
have
2.
not published it yet.
Okay, I'm sorry.
That's okay. I know you read it. You read it. That's great. I have not published it yet. Yeah. That's why you can't see it. Yeah. Because we didn't want you to get mixed up thinking it was published, to click on it and go ahead and take it without it being proctored. We want to open the door for any issues. So no, you cannot see it just yet. I'm gonna hit publish in just a few minutes. And then I'm going to call out the password and then I'll put the password in the chat. If you are going to use a scrap sheet of paper, some people use it for different things, to doodle or to calculate or whatever. Hold it for the screen front and back. The sheet of paper should be blank. If you're not using it, don't worry about it. If you are using a sheet of paper or a dry erase board, front and back for the camera that shows that it is blank. Remember, during this quiz, you should not be using any resources, any sticky notes. You shouldn't have any smart devices on, your ears, your wrists, all of that stuff. None of that is allowed. In the event that you run into problems during the exams, like I say, you never know. Hopefully, no problems happen, but put a message in the chat to me. Wait on a response. Do not come off mute. If there's a delay, it means I'm probably helping someone else. So just wait on a response for me, and I'll give that response in the chat as well. But hopefully, it'll be okay. You still should not be able to see the quiz. I have not pushed publish yet. So I'll let you know when. Just trying to give everybody a chance to get settled. Again, no resources should be used during the exam. All right, let me go ahead and push the little publish button here. I know we're in all different time zones, so I'm gonna push the time way up and push it way back. But once we all finish, I'll actually close it all the way up. So I'm gonna push it up at least to 4:30. And that way it'll cover all of our different time zones. So you should be able to see it once I hit publish. Have not hit publish yet. Let me grab the password here. I will place the password in the chat and I'll just say it once out loud. It is case sensitive. Okay. Let me save and publish. So if you were already in your modules, just hit refresh and tell me if you can see the quiz. Thumbs up if
Professor Ford.
Mm-hmm. Yes, I don't see who's talking.
I don't know what's going on with my internet here today. I keep cutting in and out constantly.
Okay. So yes, put a message
I don't know
in
if
the chat.
because from the weather or the fires or
Yes, just go ahead and put a message in the chat if that's what's going on. If you're not able to take your quiz right now, just put a message in the chat. So if you are already logged in your Canvas, you need to come all the way out, at least go to home and click the refresh button. If you are already logged in, you're going to have to come out and hit refresh. I may need to adjust the time up a little bit more, just so everybody's time frames, different time zones can be there. I think I pushed it up to 4 o'clock, and I know it's not. Is it 4 o'clock anywhere?
Dr. Ford?
Mm-hmm.
I still don't see it. I'm in week 2. It's in week 2, right?
That's it, yes.
It's not there.
Okay, let me go move my time again.
Go back out of Canvas and then come back in because it showed up on mine.
Yes, that's what I asked you all to do. Yes, if you are already in, log out because it jams it up. So yeah. So yeah, okay, it's there. So don't click on start yet because you don't have the password. You want your time to start clicking. So everyone, if you are already in there, you're gonna have to log out. Something happens, I don't know what it is. It causes you not to be able to see it. It jams it up, so to speak. Okay. If you are having issues once you start the quiz, put a message in the chat, whatever the issue is, and we'll just discuss it via chat. Because once we get started, we don't want others distracted. So don't come off mute if you're having issues. Okay. Do everyone see the quiz? For those, I have one person saying no. Did you shut your you may have to just shut your canvas down and open your canvas back up rather than go back all the way out to your dashboard.
I've completely logged out. I've exited out the internet and everything is still not on here.
Okay, so you might have to just take yours after class then, because this is there. So I have what, two that are not seeing it? Two. Okay. All right.
Could you hear me?
Yes, someone said that they logged all the way out
I'm
and still.
sorry. I've logged out the whole internet twice and mine still isn't in there.
Okay. Yes, we'll have to just address that after class then.
Okay.
All
Hold
right. So if
on.
you can't see it, just hold tight. All right. So if you can, everyone, make sure you're on mute. We're gonna go ahead and put the password in the chat, and I'll just say it one time, and then the timer will start. Again, you're not supposed to be using any resources during the quiz, you all. You know, these sessions are recorded, and I promise you they are viewed by the attendance administrator. So just to let you make an informed decision. All right, let me find the little chat button here. And the password is case sensitive. There is one uppercase letter and then one lowercase. If you finish before the 30 minutes is up, just let me know that you're finished in the chat and I'll let you know what time to return on screen. You can actually, just turn your camera off or either just log all the way out, but you make sure that you're back on at the time that I put in the chat. For those of you that are not seeing the quiz, no worries. We'll get you after class. We'll work through it because you can't make up the quiz. So we'll work through it today. But just try logging back in again, just that one more time, just to see. All right, so here we go. And the password is blue123, and it is capital BLUE123. Capital B, lowercase l, lowercase u, lowercase e, 123. And it is in the chat. I am going on mute. Once you get it, you can begin. I'm going on mute.
Now you're back. I don't
All right, everyone can come on back. We are ready. Come on back on cameras. All right, and so we'll of course push our break to the end. We're going to go ahead and make sure we go over content for week 1 and week 2, which is some of the information that you just had on your quiz. So nevertheless, we're going to move forward here. All right. So we're just going to bring it all together here. I'll share my screen. And from beginning slide. Okay, I tried to put some color to our information and some animations to it. So, but nevertheless, we want the content. But I just added something else in there just to give us a visual difference. So remember, we're looking at the family. You can log off your second device if you have a second device. We're in the community. So public health is promoting health. We want to prevent disease and injuries if we can. So that primary prevention is where we're going to start at. And hopefully that's all we need. But realistically, we know we need more than that. But public health is promoting health and preventing disease, disability for the community as a whole. We want to decrease mortality related to communicable diseases and health standards. So like now you hear in the news about the, oh, what's the name of it? Oh, I had the name, but where everybody's having the gastrointestinal issues. I forget the book that's running around. I don't know if they really narrowed it down, but we're hoping to prevent more cases. That's the whole idea. So that's why we're getting the word out. And we'll talk about the WHO and all of that a little bit more on in another slide. Public health is focused on disease prevention, health protection, health promotion. That is that foundational piece. And then we break it down, talking about when we talk about our primary, our secondary, and our tertiary interventions. So public health, and we're in the community. So the people have left the hospitals, they have left the urgent cares, they've been discharged back home. So remember, we talk about primary. When we're saying primary interventions, so some in the chat, just go ahead in the chat. Let's utilize the chat because I do want to make sure we go over all of our content for week 1 and 2 before we end. So in the chat, just put what you would tell someone that a primary intervention is. We have 3: primary, secondary, and tertiary, and we'll talk about the others here in just a moment. So primary is prevention. We are trying to prevent an injury or illness from ever occurring. And for the most part, we do it through education. It can be, let's see, what's in the news now? It's summertime. So we are encouraging children to put on their helmets, stay hydrated, because we are trying to prevent those injuries. Adolescents have gotten their driver's license over the summer. We're asking them to wear their seatbelts. We're trying to prevent an accident. So prevention, prevent that injury or that illness from ever occurring. Secondary, we're like little detectives. We're trying to screen to detect whether or not there is an injury or if there's a disease process that is actually there. And we do that. Some examples of that is administering that TB skin test. We do the little bleb under the skin, doing the intradermal, and then we come back and see if the body reacts to it. So we're screening, we're detecting to determine whether or not that person has been exposed to the tuberculin bacteria. And then initially, if a person does not have any breast abnormalities, all those mammograms they have done are really screening mammograms. The mammogram is done to detect or determine if there's some type of abnormality to the breast tissue. Now, after abnormality is determined on a mammogram, the next mammograms are done as part of tertiary because there has been a abnormality found. So tertiary is where we are trying to assist that person to manage a disease process, or if there was a broken bone, we want that bone to heal. So tertiary prevention can include pharmacologic and non-pharmacologic agents. So primary prevention, secondary, we're screening, trying to detect or determine. We give you some examples, and then we say tertiary. trying to help that person manage and get back to their optimal level of health. This is just another way of pulling it all together. Primary, prevention, prevention, prevention. Prevent it from ever happening. Action, general specific measures in the predisposed population. Some examples are vaccinations. Now, we said screening was a TB skin test because we're trying to detect or determine, but vaccinations, we're trying to prevent. For example, if we give the COVID vaccine, we're trying to prevent that person from actually having COVID. If we give the chickenpox vaccine, so we're trying to prevent. So education about gun safety, making sure where the firearms stored. Are they stored, the firearms and the ammunition, are they stored together? We want to encourage the person to maybe go to some gun, what do they call, gun safety classes. We're trying to prevent an injury or something actually happening. Secondary, we're detecting, we're trying to diagnose, trying to see. Again, screening, testing, surveys. Screening, secondary can also be in the format of a questionnaire. A lot of times what they've trended to now is the babies will go in and the parents, they'll ask the parents, they'll do the lead survey. And so, but that's secondary. So it doesn't have to be a TB skin test. It doesn't have to be a screening mammogram or x-ray. It can actually be a survey, a written survey. And then we told you tertiary was trying to assist that person to manage. If there's a broken bone, we want that broken bone to heal. So we're giving them pharmacologic and non-pharmacologic intervention so that bone can heal, that they'll be in less pain, so that they can provide for themselves their activities of daily living. Any questions about primary, secondary, and tertiary? Okay. So remember what we said about public. We are there for them. So community-based nursing, by definition, let me move us out of the way here. Community-based nursing is a setting-specific practice in which care is provided for sick individuals. So for individuals, okay, and families where they live, work, or attend school, the emphasis is on acute and chronic care and the provision of comprehensive, coordinated, continuous care. These nurses may be generalists or specialists. It could be anyone on that healthcare team, but the idea is we're giving care to a specific person, okay? Community-based nursing emphasizes, did I write that 2 times on acute care? Yes, I did. The healthcare team working together to manage care for a client. So we're working on with that individual, community-based, okay? Community-based, right? Again, so an example would be we're teaching a person to do self-blood pressure measurements for if they are newly diagnosed hypertensive patient. If they're newly diagnosed diabetic patient, we would teach them how to do the finger sticks and how to read that sliding scale. If they're newly diagnosed asthma, how to use that spacer or the inhaler. Okay, we're working with that individual. So how do we know what our communities need? There's a thing called a windshield survey. And literally we go through the community and we observe. We look at the environment. We look at social interactions. We look at the built environment, like the buildings and everything that are there. We talk to the people. And then that's how we find out what it is that the people actually need in that community. Okay, so defining the scope of public health and community practice, we just said public health is promoting, this is all those slides we just looked at, we bring them back again, promoting health and preventing disease. That's the public health main issue, main goal. Community-based, it is setting specific care provided for the individual. Community-oriented, we're providing for the community as a whole. We're not just working with that 1 or 2 individuals. Okay, community-oriented focus on diagnosis, health surveillance, and evaluation of the broader population. That's community-oriented. Okay, so some examples of community-oriented would be conducts eye exams for all the community members. Remember, community-based, will we just be working with that 1 individual? For example, if they had to have cataract surgery, we get them to their appointment. We go through how to administer the drops after they have the surgery, how to wear the patch. We're working with that 1 person for community-based. But community oriented, we're working with the entire community. We set up a clinic and we have eye exams for everybody that wants to have them. Conducts COVID vaccinations, conducts flu shots. You all may have even done some of those in, during your rotation, but that's community oriented. Okay. So again, this slide is duplicate. We just looked at it, talked about all of those. So now, how do we pay? How does a person pay for the healthcare services that they actually are receiving? And how much do those services actually cost? Healthcare services are expensive. And what they say is that while, we have the public insurances, we have Medicare and Medicaid, we have the VA insurances, they are saying overall, when we look at different countries, our healthcare costs the most, but then our outcomes is not as good as other countries' outcomes. So let's look and see how we're paying for things. We know that public, we have Medicare and Medicaid. Medicaid is income based. And Medicare is generally we take care of the elderly. There are a few persons if you are younger than 65, but if you have end-stage renal disease or ALS, you automatically get the Medicare. So you can have both. A person can be dual eligible, meaning they can have Medicare and Medicaid. Medicare will pay first, and then Medicare covers the qualified remaining costs. Okay, so Medicaid is income based, and also with Medicaid, it expands healthcare, but you can go. It varies from state to state because it just depends on if that state actually accepted the funds from the federal government to expand access to healthcare in their state. So therefore, a person may say, well, hey, I live in this state and we have this resource. And they're like, well, we don't have that. It's because both are on Medicaid. They receive the Medicaid to help pay for their healthcare services, but they will not have the same services because if their state did not receive the monies to, and the states can't afford to pay for it, then that's not a service that they would offer in that state. These payer sources mobilize care into community and outpatient settings. So think about this right here. Patients have to receive specialty care. So what we're seeing now is, for example, the urologists, the neurologists, even the oncologists, what they're doing is they're coming down to the communities, even if it's one day a week. Because states have opened up and expanded that access, that extra help to pay for these services. So those doctors are leaving their routine offices and coming down to the different communities, especially like the rural communities, even if they don't serve at that one day a week. And that allows for that patient, for healthcare to be a continuum. Why is it that a person that needs a specialist and they have to travel, 4 or 5 hours just to get there to the next town? Well, it's a good thing that they're doing that they expanded that. And so that those healthcare providers can be available in those persons' communities. Okay, so then we have the World Health Organization. It just released some new guidelines on dementia, but it focused strictly on global health. You all remember, when they declared COVID a pandemic, the World Health Organization was the one that sits and looks at that information. They gather it. They work with the CDC, but they're gathering all this data. And at some point, based on the definition, they had to declare a pandemic. And like I said, they did just release some new guidelines on dementia, but their focus is on global health. Global health. They're just not looking at, just, one country or the other. It's global. Okay. So they have 7 factors, and they look at income and social status, education. So think about education. Not only low education is linked to poor health, more stress, and lower self-confidence, but if a person has a learning disability, we want to consider that as we are thinking about whether or not this person is vulnerable. If we're talking about vulnerable populations, we're gonna assist all of our clients, but we want to make sure that we actually look at all of these factors here. Income based. Does this person have the income to travel 2-3 hours away to actually get to that specialist, or do we need to get them on the appointment schedule rotation when the specialists come to their area? But we want to think about and consider learning disabilities. The physical environment, is it, is there safe water? Is the air clean? I think someone just mentioned on here, and I did hear about it earlier, and they're saying that smoke or whatever probably is going to drift to several states. Social support. Do people have family and friends? And are there things in the community? Do they have that backbone that, can they call upon? A storm come up, communities, the homes are torn up and destroyed. Where can the community go? Is there a shelter? What's the plan? So the WHO looks at all of that: genetics, health services, and then also gender, because we do know that there are different types of diseases where men and women actually experience them at higher rates than each other. Early identification requires reporting, surveillance, while disease spread requires risk communication. Okay, so we're reporting, we're surveillancing, we're keeping up with, well, where did you go? Who did you meet? Who was there? I'm sure they're doing they call it contact tracing, so to speak, too. Their surveillance thing with this, because they're trying to identify. Someone come off me and tell me what's the name of that, the GI problem that everybody's having, or the bacteria that they've identified. I can't call it right now, but it's in every state, and people, they're not dying from it, but they're just hospital sick, where they're just having severe diarrhea, nausea, vomiting. Anyone know what I'm talking about? You all heard about it?
Is that the cycle? What is it? It's cycle
Like a cyclosporin, something or other.
forest, yeah.
Something like that, yes. So early detection. So now we all know about it. At first, I guess it was a couple of cases here and there. Really wasn't thinking about, but now it's so widespread, and so many people have it. So they're putting the information out there so that we can hopefully not get it or come in contact with it or be more aware of it. So washing those hands. I don't know if they've linked it to one thing or other. I kind of heard one of the news reporters kind of allude to lettuce or something like that. I don't know. But just making people aware, providing that education. We want to address and assess barriers. Like I just told you about the learning disability. So we have all these interventions, but we want to make sure that they're specific to the person, because if I have a problem reading and the information that you want me to absorb and understand is in writing and I can't read, I need to change that intervention for that person. So we do not want to promote equitable distribution of preventative interventions such as vaccinations, just health information altogether. Okay. So QSIN is not a federal agency, but it defines competencies to improve the quality and safety of healthcare systems through nursing education. Quality and safety in nursing education. A lot of facilities have the educational nurse, so when you go in, you're trying to think about your settings, and some of you already might be working in the settings and on this team, but they do have that safety and education team in a lot of healthcare facilities. Okay, so then we do have the Agency for Healthcare Research and Quality, the leading federal agency. They're monitoring health quality outcomes and services. And all of these agencies, they're regulatory, just to ensure that the public is safe, that the public is getting that best healthcare that they possibly can. And then we know about the good old Nurse State Practice Act. It is state specific, and it is our lawful to-do list. Those things that we can lawfully do, in that this is here to protect the public. A Nurse Practice Act serves to protect the public by setting minimum qualifications for nursing in relation to skills and competencies. It's those things that we can lawfully do. One way it fulfills responsibility is to protect the public by defining the scope of nursing practice in that state. Now, for those of you, like I think I mentioned it to you all, maybe in the other class, you can get your temporary license, but make sure that you are working on the temporary or your real license. Don't go out there, signing up saying that you have license and you don't. That whole, I don't even know how that thing is even occurring. But anyways, it's real. The state boards of nursing approve schools to operate, but does not accredit them. It does not enforce ethical standards. Okay, so each state has their own state board of nursing, and also that is usually a voluntary position. But those boards, you can actually be on the board in your state. and help oversee. Now, this slide is just pulling all what we just said back together. I didn't talk about the Affordable Care Act. Let me talk about it. So, like the slide I asked, well, how much does healthcare, who pays for healthcare? How much does healthcare cost? Healthcare is very expensive. I don't know if you've ever looked at a bill, or that is really not that bill. They send you like that summary of how much things would have cost, or how much they actually cost, and how much your insurance paid, and how much you still owe them. It's very expensive. So the Affordable Care Act was created to do primarily what the wording says, to make it more affordable, so people will have more access, so that people would not be penalized for living and trying to have to live in their optimal health. Before the Affordable Care Act, if you had hypertension documented on your record, insurance companies could deny paying any charges that were related to hypertension, because hypertension would have been deemed as a pre-existing condition. So the Affordable Care Act got rid of that part. But it was just to make healthcare more affordable, to break down those barriers, make it more accessible for everyone. So again, we want to look at, as we're in the community, we want to think about the social determinants of health, because it does matter in the event that my housing is not stable. A storm came, we don't have housing. Where do we go? The community doesn't have housing for their people that live in their community, so they would have to go to neighboring towns. What's going to eventually happen to that town? And that town, if they had a huge business and industries there, it's going to eventually fail. If we don't have fresh fruits and vegetables, like right now, where everyone's, celebrating the summer, we're here and there. And if we think it's that lettuce, if you think we're getting ready to eat anything with lettuce in it, probably not. Or the chances there are going to be less. And so what's going to happen to the lettuce industry? I don't know if that's what it was or not, but we definitely know people are sick. A lot of people are sick. So education, we just mentioned how that's linked. If I have a learning disability, we want to keep that in mind, because that's going to make me more vulnerable. Access to healthcare. I gave you those examples about the specialists, them coming down, and built environments. Well, we were doing a survey, and we're asking people, hey, do you exercise? Are you interested in exercise? If you don't exercise, why don't you exercise? And a lot of answers was, the sidewalks were in ill repair. I would walk, but I may injure myself from walking on my sidewalk. Really? So anyways, those neighborhoods were actually funded, and the sidewalks were repaired. And guess what? You see people actually out walking, because it was either walk on the sidewalk and run the risk of falling and injuring yourself, or being in the highway. So of course, we want people safe. So people just stopped. They didn't exercise in their community. But stepping back, like I said, that windshield survey, we're cruising, we're talking to the people, we're looking to see what we actually observe and what we're seeing ourselves. Okay, so the home visit life cycle assessment and safety protocols. So pre-visit planning, assessments are voluntary. Families make judgments during the first call. We want to identify ourselves and state the purpose clearly. This right here takes a while. We want to arrange a convenient time for the family. And sometimes it's not always the time that you think, but we want to go when it's convenient for them, because remember, it's for them. Okay. And so confirm exact locations, directions, ask if there are any pets, anything that you need to be aware of. You want to even make sure that, especially if you have to go after hours and it's day has given away tonight, is it going to be in a well-lit area? Do you need an escort? If any area is dangerous, leave immediately. Safety is going to be first. Then we want to assess specific factors, increasing illness and likelihood, risk reduction. It can be complex, but it requires understanding that family's perception of what's going on. What's their understanding? Okay. So mapping tool, talked about genograms, where you're actually looking at the genetics of that family. Are there some predispositions? Then we can do an eco map, looking at that environment. What things do they have access to? What are some barriers? So we want the family to be functional And dysfunctional doesn't mean, and dysfunctional means that do the family have the resources and or the to-do-ness in the event that there is a crisis. You're not dysfunctional if you have a crisis and you know how to, and you're resilient and you figure out what's your next steps. That doesn't make you dysfunctional. Things happen to everyone. But dysfunctional is considered in the event that there's a crisis. Is this family equipped to pivot and move on to the next step? To pivot and to seek out resources so they can move on to the next step? Do they have the communication skills? Do they have the research skills? Do they understand? Crisis occurs when families completely fails to cope with an event, leading to severe dysfunction requiring community nurse intervention. So we do want to equip our patients, community members with, making them aware of all the resources in their area. I know a lot of towns have like a resource day. I know in our area, the one of the huge news stations, they actually sponsor one of those days. And what happens is all different resources, anything you could think of from A to Z, from the public health department, from the state troopers, pretty much anything you can think of. Lawyers are there, and they have them in like these buildings because there's so many vendors and things there. But it's just making people aware of what's in your community, because you just never know on this journey, we just never know what we'll end up needing. So dysfunctional is in the event that something happens, we're not able to cope or be resilient. Families are neither all good or neither all bad. Family have both strengths and difficulties, and they have some seeds of resilience. We want to water those seeds, armor them, and equipping them with the resources that they need. Recognizing the family's strengths give the nurses assets on which to draw in when we're planning that care for them, creating environments that are conducive for positive family interactions. We want to build on the family's strengths and resilience. We want to, and part of that is identifying what those weaknesses are as well and talking those through so that we can strengthen those weaknesses. Okay. Assessment of families requires an organized plan. This is what we just said on the other slide, including the purpose of seeing the family, which family members can be present, who you are assessing and why, and how will you obtain the necessary data. The preferred time to visit is when most family members will be available. It is most informative to interview the family as a whole so that you can observe the family interactions. Effective family structure is characterized by clear roles, communication, flexibility, the ability to bounce back, to pivot, adaptation to stressors. We want to avoid a family in crisis. So things happen, but we want to equip this family so that in the event that a storm comes, someone loses a job, that they know the resources or have don't be afraid to reach out for assistance because we have these resources in the area. So the risk landscape across the lifespan, we're going to talk about the infants and the toddlers all the way up to the older adults. So leading risks for infants and toddlers, we're still seeing SIDS. Interventions, we want primary preventions, educating those parents about sleep safety and vaccinations. School-age children, leading risks is overall injuries, motor vehicle accidents due to difficulty judging speed and distance. Adolescents, motor vehicle accidents, weapons and drugs. We want to, if they want to own firearm, make sure you take the safety classes. Do you understand how to use it? We want to store ammunition and the actual firearm separately. Contraceptive counseling. So older adults, chronic diseases are the leading risk for them. We want to still encourage them to, hey, still get out and move. Join the walking group, go to the wellness centers. They're all around, and they do have all different types of programs. If you actually look into the different programs that these wellness centers offer, it's like, wow, do you have to be an older adult to attend? Because they do some interesting things, all different kinds of stuff. So changing gears here, school nurse responsibility. We're still in the community, watching our time. We do provide healthcare to children, just a routine healthcare. Students will be taking PO medications. Sometimes they'll get injections. Sometimes they'll have what do you call those things? It just left my mind, y'all. Suppositories. I know that one is a big one for children that have seizures. So you just never know. But nevertheless, we provide routine care for our children. Administering medications is a big one. But there's some times when we have to provide that emergency care. The children out in the gym playing PE or out on the baseball field playing and something happens. We might have to call the ambulance. We might even have that child might even have to be airlifted. So emergencies do happen. So we all hands on deck, and you just never know what'll happen. But we do, in addition to that, school nurses keep track of the state required vaccinations that children have received. If children have exemptions, they still keep up with that. Carrying out required screening of the children based on the state law. A lot of times they do the lice screening, they do the scoliosis screening, the hearing screening, and vision screening. They usually assist with those. We want to ensure that children with health problems can learn in the classroom. In the event that that child needs to come out and get a tube, get fed through their tube, that's done. That child returns to the classroom because we do want them, to be involved as much as they can. The nurse can begin prenatal education and counseling on nutrition if that need be, substance abuse, use, exercise, and special medication concerns. These topics are essential for promoting health in pregnancy and preventing complications when we're talking about the pregnant teen. So talking about the school nurse. The school nurse is mandated by the state law to report suspected cases of child abuse or neglect. We are mandated reporters, you all. A nurse who identifies a child who may be abused must contact the appropriate legal authorities and the school's principal. Signs of potential abuse include unexplained injuries, bruises, poor hygiene, dirty clothes, unkept hair, and unusual fear of the nurse or others. We have to report it. The nurse should protect the child from harm and let the government authorities, usually the state and county officials, will come in from the Department of Human Resources and investigate the suspected case. You don't have to know all the details, but if you suspect, we are mandated reporters. Okay, this is just looking at all this again in a different slide about the school nurse. So the Child Nutrition Act funds school lunches, pregnant preschool supplements, FERPRA, Family Education Rights and Privacy Act, mandated reporting. State laws require reporting of suspected child abuse and neglect. Routine clinical management. We provide education, and then we'll be called on too. Also, a lot of times for the PTO, the parent-teacher meeting, you may be called on to provide primary interventions, to provide education about something. Okay, and then crisis intervention. School nurses, you wear many, many hats in that setting. So I thought I had another slide over here, but I may have it out of order about school nurses, but we'll keep going. Healthy People 2030 and the balance of vulnerability. Vulnerability is a susceptibility to actual or potential stressors leading to adverse effects. Stressors include, like we said, poverty, chronic disease processes, access to medical homes. If a child needs, care at home, is that home a medical home? Do they have the medical supplies and equipment in that home? For example, a child may have, excuse me, some type, and I can't think of what it affects their vision, but they may have to create this medical home where they come in and they redesign the home or they add things to the home so that child can, still go through the house without falling and injury and still be able to take care of themselves, still be able to bathe themselves and things like that. And those are called medical homes. And so remember, you all of these, it's time for you all's break. So that means you all are free to log off. Let me stop and make sure I don't have any questions, but I'm going to still keep going because on this PowerPoint, I just pushed everything together. I pulled out all those pieces. So you need to ensure that you go back through this recording. Just as soon as I finish talking myself through it, I'm going to download it and then upload it again. I don't have but a few more slides, but just make sure that you go back and listen to the recording. Any concepts that you are kind of shaky on, put those at the top. That's what you want. That's where you want to start at. but I've condensed everything and kind of went through everything and just kind of pushed it out of all those slides and things we have. I've kind of condensed it here. So I'm going to stay on and just finish talking through those. Feel free to stay on, but it's actually time for your break. And so we will see you on next week. Let me say this before you go. If you have accommodations, approved accommodation letter from the school, you need to send that in. In the event that you want to have your exam proctor, remember you have that 72-hour notice. You have to find a approved faculty by your campus dean. That information should be communicated in an email. I think that's it. Make sure you have your 2 devices, and make sure you go back through this. Make sure you go back through this recording because I've narrowed it all down and put it all together for you. Got it compact. So if there aren't any questions, you're free to go, and I'm gonna keep on talking. I think I have about 5 more slides, but I want to be good stewards of your time. So it is break time, so you can go. But otherwise, just stay and I'll keep on talking. So we have the evidence-based framework here. Cultivating a spirit of inquiry starts with the clinical question. Okay. Asking the question and searching for, because right here we want to see, well, what is the question? And then we have these steps: critical appraising the evidence. Let's look at the evidence. What does this evidence mean? Do we have all of the evidence? Are we missing information? Are there any gaps? And then let's integrate the evidence and evaluate the outcomes. And then we disseminate the outcomes. The evidence-based practice process follows a logical sequence to improve patient outcomes. The nurse first must formulate a clinical question, and I'm just rewording what we already have right here on these slides. First, formulate a clinical question, then searches for and appraises the evidence before implementing that change into practice. The final step is evaluating. That final step is evaluating our outcomes to determine whether the intervention was effective or should be continued or modified. Do we need to do something different? Okay, that's the evidence-based model. Okay. A living will allow the client to express wishes regarding the use of medical treatments in the event of a terminal illness. The person expresses what their wishes are. And that's that living will. The durable power of attorney is a legal way for a client to designate someone. So the durable power of attorney specifically picks someone to make those decisions. The living will does not. That person leaves their wishes in writing, what they want. Okay. The advance directive is a broad category that includes both of the living will and the durable power of attorney. Okay. A DNR, do not resuscitate order, is a specific order from a physician not to use CPR, cardiopulmonary resuscitation. That's a legal document. Okay, this is just pulling it all back together. The living will, those are the person's wishes. The dual power of attorney specifies someone to make those wishes and give those instructions about the person's care. And both of these fall under an event. They're considered advance directives. So self-determination and autonomy. Patients have the right to make informed decisions about their care. Setting patients' goals based on their own choices is practicing self-determination. Okay, so neglect, understand, required legal elements of failure to provide. Remember those four elements. That we have a duty to take care of those patients, and those care plan guides us as what we need to do to take care of them. Okay, advocacy versus social injustice. Nurses advocate to eliminate systemic disparities and protect vulnerable populations. When we talk about vulnerable populations, if I have a learning disability, that person's more vulnerable. Nothing's on this slide. I forgot to take that one out. That person is more vulnerable. So our interventions would not be the exact same as they would for someone else. And remember, you always have math on your exam. So this right here is just a quick reference. I'll pause for just a moment so you can capture that. And that should be our last slide. Okay. Any questions? I see most of y'all are still here. Any questions about anything that I just went over? Week 1 and week 2, not a whole bunch of information, but information that you need to know. So you have community-based, community-oriented. You have the school nurse. You have all the different levels of intervention, how we're paying for healthcare. And just remember all those different things. Make sure you go back through this recording. Just take the time and look at each of the slides that I have. I put the information together, then I pulled it out. So, any questions or concerns? If not, have a good night. We'll see you next week. Exam 1.
Okay, you too.
Good night.
Good
Can I
night.
ask you a question about the quiz?
Yes.
Um,
All right.